talk a little bit about the assignment that was turned in, the first assignment that was turned in, pass those out to you, and then we'll have our fun time. Still probably get you out with a little bit of leeway to maybe run to Starbucks real quick. So when we talk about a sexual history, why do we ask grandma or grandpa or anybody for that matter about their sexual history? And the main reason is because probably nobody else has ever asked them. And half the time they have something that is a question to them. And remember, it's just like my biology teacher back in high school. As long as they ask you with a straight face and they really want to know, or they can even be giggling about it, but you can't be giggling about it, then they deserve a proper answer, right? They deserve a medical answer because half the time they don't know if something's normal or abnormal. How many people in here have seen 50 Shades of Grey? Only women. So, maybe nobody wants to admit that they've seen 50 Shades of Grey, at least in that way. You can say you were dragged there by somebody. So this was me over, it must have been like November. And I went to a movie on 3 o'clock on a Thursday by myself or something. And the first thing is, coming. And it was a preview for American Sniper, okay? And it says, and I'm there, and everybody else in there is like fixing to have a heart attack. That's in the movie theater with me. And it's American Sniper opening Christmas Day. And they were all like, oh, nice Christmas movie. And the next movie that comes up is 50 Shades of Grey. The preview for 50 Shades of Grey. Opening February 13th. And I was like, that'd be awkward. Okay. But, your patients, trust me, your 80-year-old women, they have read the trilogy and they're back on it a second time around, okay? So they may have questions, and if you don't ask them and actually open that dialogue, nobody's going to feel comfortable to approach that with you. You have to be the one to breach those topics, okay? So it's so much easier to talk about a sexual history once you know. Are they married? Do they have a partner? Are they homosexual? Have they been with the same partner for 22 years? Okay? Are they single and kind of date everyone? Okay, makes a little bit of a difference, but helps to drive your conversation about sexual history. So your key with sexual history, if Stacey helps if I turn this on, is, again, so it helps if you know their marital status. Typically, we talk about using the term partner, but if you know they're married, and it's an 85-year-old man who's been married to the same woman for 60 years, don't call his wife his partner. Call it his wife, okay? Typically, your older population doesn't necessarily like that term partner because half the time they associate it with homosexuality, which for better or for worse, your job is just simply to try not to offend your patient, okay? Your job isn't to change their viewpoint. Also, you have to understand, here we have kind of a pretty large retired military population. My parents actually live over in Melbourne, Florida, which is a huge retired military population. And a lot of those times, either military or wives who have been widowed from big companies will not get remarried because they might be actually pulling a pension from their husband who passed away. And if they get remarried, they lose the husband's pension. So as you talk to my dad about it, he talks about the 85-year-olds who are shacking up. And I'm like, Dad, they're probably not shacking up. I mean, they're living together, but, they aren't married, but they've been with the same person forever. So it helps to drive that conversation about sexual history. You always want to maintain your objectivity. It doesn't matter, as my mom would say, you only don't have to live with the person. Somebody else has to. So it doesn't matter what their sexual orientation is. And it doesn't matter if, I had one patient, I said, how long have you been married? As I'm looking at his wife. 50 years. His wife was not 50. And I'm like, really? 50? I said, she your first wife? She's my fourth. So he meant cumulatively he had been married 50 years. That's a little bit different. Again, as my mother says, he really believes in the institution of marriage. So you want to be sensitive to cultural issues as well, okay? You also want to ask about any sexual problems. It might be the conversation of your perimenopausal or just soon after menopausal female who has essentially like vaginal dryness, and she doesn't want to talk to her gynecologist about it. Or maybe she hasn't been to a gynecologist in 10 years, okay? But she's wondering why it hurts to have intercourse. And if you don't ask her, hey, how are things going? Are there any issues? Are you and your husband or are you and your partner monogamous? any problems with any sexual issues. That she may never bring it up, oh, by the way, we don't have sex that often because every single time it kills, okay? Conversely, you may have your male population who is starting to have erectile dysfunction or has erectile dysfunction, and they just think, oh, it's part of aging, oh well. Well, it doesn't have to be, okay? Sexual activity is a normal part of adulthood, and it's a normal part of being a person. So if you have your patients and they just want to slough it off, well, I guess we're just not going to have sex anymore. There's stuff that can be done, okay? There's medications that can be used. There's surgical procedures that can be done. But if you don't start to open up that dialogue with your patient, then even if your 45-year-old is having no problems, 5 years later when he is your 50-year-old patient and maybe has hypertension and is on a couple medications that are affecting his erectile function, he's never going to feel comfortable to say, hey, by the way, this is starting to become a problem, okay? And again, some of that stuff goes towards stressors that can occur within relationships and within marriage, okay? People don't just, my friend is teaching across the hall genetics, okay? She's a PhD in something, I don't know what. Known her for like 20 years, I still can't remember what she has her PhD in. She does the TAVR program at Health Park, so she's a clinical coordinator for the transaortic valve program at Health Park. Her 99-year-old patient, just shy of her 100th birthday, had her aortic valve replaced and wanted to know when she could be sexually active with her 85-year-old partner, okay? I mean, kudos, she's going for a younger man, which is fantastic. I know you can't really go old. That's true. But, she asked, and she was serious. But, had literally never had that dialogue with her about, hey, who do you live with? How are you in a monogamous relationship? How are things working with your partner? I'm sure, well, she's spry 99-year-old, probably still would have asked her, probably. But, they just said, truly, you need to wait about 2 weeks for your wounds to heal and then have at it, have fun, Seriously, what are you going to tell 99? But you just always want to be open with your patients. Your goal is to not be creepy. And that is the technical term, okay? You don't need to freak your patients out. You haven't, remember, this is still the psychosocial history. You haven't even touched your patient yet, probably. And if you start being weird with them, they aren't going to let you touch them, okay? So you got to make sure that you're asking enough to where if they have additional questions, they feel comfortable actually asking them to you, and that you're not, let's be honest. A lot of your patients are going to look at you and be like, you could be my granddaughter. And I feel a little weird talking to my granddaughter about my sex habits, okay? So you have to just open up that dialogue. And again, remember, long term, you want your patients to feel comfortable coming to you, okay? Things may creep you out. You can't, again, poker face. You can't act like they're creeping you out right in front of them. You also can't go right outside the very thin door and be like, did you just hear what Mrs. Smith is doing at home? Okay? Red Room of Pain? No. You watch the movie, you know what that is. So your goal with sexual history is just to be very short and very brief. If they have a risk for STDs, okay? Anybody know in Florida the largest community that has a risk for sexually transmitted diseases right now? It's Florida's friendliest hometown for a reason, okay? You can either move there to retire or to have an infectious disease rotation. Go ahead and pick which one. So the Villages up by Ocala, it's a retirement community. It is all, for the most part, a heterosexual population, chlamydia and gonorrhea like crazy, okay? And HIV, okay? So it is not just, everybody just, associates HIV with your gay male population. No, not in Florida, okay? Just be very, it doesn't just matter what someone's sexual orientation is. Yes, ma'am?
Just an interesting fact about that. I lived in Ocala, and I was
anything you'd like to share with the group?
Not retired yet. I worked at Quest Diagnostic as a phlebotomist, drawing blood, and a lot of times the patients would come in and it's none of my business, their history or anything, but patients just tell you.
Yeah.
So a lot of times they'd be very nice, well put together older women or well put together older men, and they're like, this is just a precaution. I'm like, oh, so they're getting checked for HIV right now.
Yeah.
So, okay.
Oh yeah. So again, you ever want to retire there one day or have a good infectious disease rotation, probably a good place to look into. She worked for Quest Diagnostics. She might have some contacts up there. But again, you have to open that dialogue, because for your patient who is sleeping around, you know, to use the college term, and has multiple sexual partners, they're at greater risk for sexually transmitted diseases. And a lot of people, especially your lower educated patients, I guess I should say, they use some interesting stuff for birth control, some interesting food products, i.e. half a potato, or a cervical cap, or a diaphragm. And they think it not only prevents pregnancy, they think that it prevents sexually transmitted diseases as well. So there's lots of kind of weird cultural things that are out there that if you don't really act, oh yeah, it's not a good pelvic exam to have to do on that patient, trust me. Then they're done. Oh yeah, and that's northern Florida. That's not too far away from here. So, you know, you have to be able to ask that of your patient, and again, not always look like you're constipated, and not always look like everyone has cancer. Okay, so you have to have a poker face. All right, so we're going to go and we're going to talk about, first we're going to talk one note that I want to kind of review with everybody. And I don't know, I didn't ask for permission to use it because I'm not that nice. So this is someone who, oops, Daisy, how do I put this up here? View? I don't know, can I view this up here? Maybe not. All right, so I'll read it to you because I can't put it up there for some reason. Aha, there we go. Okay. So chief complaint was I'm having a lot of pain during intercourse, and this is how it was written. This is a concerned 63-year-old Caucasian female presents with the above stated chief complaint. That's always very good. The chief complaint was in quotations, which is what I wanted. She's been experiencing excessive bloating, malaise, fatigue for the past 3 months. She started with severe back pain 5 weeks ago, which has progressively worsened, takes medication Advil twice a day since the onset of the back pain. She had severe and debilitating pain during sexual intercourse. Note that that's what brought her in, but that only started recently. So that symptom began about a week ago. On the onset of the symptoms, since the onset of each symptom, they've been continuous. The patient has a history of ovarian cysts and menstrual irregularity prior to menopause at the age of 51. Patient states that her mother had to have a hysterectomy at the age of 52 when she was diagnosed with ovarian cancer. Okay, so this is kind of how I would have potentially written that note. 63-year-old concerned Caucasian female presents the above stated chief complaint. 3 months ago, the patient began experiencing bloating, malaise, and fatigue. Approximately 5 weeks ago, she developed severe back pain, which she's been taking Advil twice daily for this complaint. Only within the past week has she begun to develop severe and disabling pain during intercourse. This final symptom is what prompted her evaluation today. Each symptom has been continuous since onset. The patient has a history of ovarian cysts and menstrual irregularity prior to menopause at the age of 51. Of note, the patient's mother had a hysterectomy at the age of 52, secondary to a diagnosis of ovarian cancer. Okay, so the only thing I changed a little bit was the timeline, because as you're walking someone through something, it just, if you put the times at the beginning, it allows people in their mind to chronologically put things in order, rather than if you're putting the time frame somewhere, this time it's the beginning of the sentence, and the next time it's in the middle, and the next time it's at the end. If you're just consistent with how you do it, it helps walk them through. And especially for this note, she came in because she's having pain with intercourse, but that's actually the last thing that actually happened. On this note, what other things with that patient and your concern for ovarian cancer might you want to know? What other questions might you want to ask her? Yes? Okay, history of pap smears, right? She may not have had one for 10 years, because a lot of your women who have been with the same partner, who've been married forever, their last pap smear was like right after they had their last kid. She's 51, her last kid might be 20 years old already. Yes? Okay, if she had a hysterectomy, because some women will say I had a hysterectomy and they think they took everything out, when in fact they take everything out but their ovaries. Okay, so did you have a hysterectomy? Did you have a complete hysterectomy? Did they leave your ovaries behind? Oh yeah, they did. Okay, yes.
If she has a history of cancer.
If she personally has a history of cancer, right? Okay? Anybody else besides the mom had a history of ovarian cancer, right? Because we know ovarian cancer is unfortunately a pretty silent killer. Really, the only way that you detect it is by manual exam on a pelvic exam. Okay. What's another thing that you're worried about with cancer in general? Weight loss. Okay. You know, if she's had symptoms for three months of bloating, okay, bloating, they get bloating because they essentially have a mass in their lower abdomen. They describe it as bloating, but what it is really truly is the growth of the mass. So if you have someone, and most women will be like, yeah, as a matter of fact, you know what, I've been able to lose 10 pounds. And they're kind of happy about it. They shouldn't be, okay? So the big thing, if you're worried about potentially cancer on anybody, always, how's your weight been? Been pretty stable? Been pretty stable, okay. Typically then your radar should drop down a little bit. Oh no, I've lost like 15 pounds and I've been eating like a horse. That's a concern, okay? So that was just one that I looked at, yes.
I have a question.
Yeah.
I hear it started with most recent
Mhm.
symptoms. Do you find a lot of people want to start at the beginning of the story, and is it okay to record it from the first to the most recent thing? The other way chronologically.
You can. You could say, you know, what brought her in today was the fact that she started having pain with sexual intercourse that started a week ago. Unfortunately, 5 weeks prior to that, she began having back pain, and 3 months prior to that, she noted bloating. So you could go in the opposite direction. Most people go from the time they were normal and walk you to present. Okay.
And then always put the patient history and family history
At the end, you know. And one way to kind of draw attention to that is to say, of note, she's had this, you know, because all of a sudden it makes it sound like, okay, I've got it. That's important in terms of family history, but it's important to her history of present illness, more so. Okay. So let me pass out your papers. And then we'll have our fun game, okay? And I kept a copy of these, so I scanned electronically a copy of everybody's. You'll get to know me over time.